Well, speaking of opening the beaches, joining us now, Democratic Governor Phil Murphy of New Jersey. Governor, good morning. Good to have you with us again today. Obviously, this Memorial Day weekend, a big day, a big weekend for anybody who lives in New Jersey. As someone who grew up there, I can tell you, putting the cooler in the car and driving down the Parkway to the shore, this is when the summer starts. You are going to open some of your beaches. Explain the decision to open them and how exactly those beaches will look, because obviously on a typical Memorial Day weekend, they would be packed.
Good to be back with you, Willie and team. I'm going to put aside for a minute, Mother Nature doesn't look like she's going to cooperate in terms of good weather this weekend. So I think, honestly, the attendance will be lower than it probably would be. But we made the decision based on the data. And Joe just sort of said this. We believe that public health creates economic health, not the other way around, and that we don't want to jump the gun. But we've had we've had a staggering loss of life. I mean, now over 10,700 blessed souls in New Jersey. The other data, which is more prescriptive, more predictive, has gotten better for the past several weeks. So we started a few weeks ago. We opened county and state parks. We've taken a whole number of other steps on things like non-essential construction, curbside pickup at non-essential retail, elective surgeries, a whole series of steps. You rightfully point out beaches are a big one. We think we can take it because the data is allowing us to. We clearly have more latitude outside than inside. And the two big levers that the local mayors and counties, and they've been fabulous to work with, are pulling are both capacity constraints, which is what we've done with the parks, and then social distancing, enforcing that. Strong recommendation to wear masks as well. And so with that, we believe we can responsibly take this step, and we'll continue to take them as the data dictates and allows us to.
Governor, you mentioned more than 10,000 people have died in the state of New Jersey during this crisis. A unacceptably huge, devastatingly huge chunk of those have come in long-term care facilities, veterans' homes, nursing homes. On March 31st, the New Jersey Health Commissioner put in place a rule that those long-term care facilities had to readmit COVID patients from the hospitals. They couldn't test them. They couldn't ask them anything about their COVID diagnosis, whether they still had it. Was that a mistake, and are you looking at overturning that in the same way that Governor Cuomo did in New York?
Yeah, so Willie, the tragedy within the tragedy, you've said it, is in long-term care facilities. That's not just in New Jersey, it's in the country, but it certainly is in New Jersey. And a big percentage of the lost lives come from there, including, as you said, from our veterans' homes. It's been an incredibly uneven performance by the operators. We started long before March 31st. Our Department of Health started on this with directives for long-term care. We've put the National Guard in. The VA is in these homes. The Attorney General is actually doing an investigation. We hired a national firm, not just to tell us when this is over what we could have done differently. We want them to tell us now what we could do differently or could have done differently. They're actually working on that right now. I don't want to jump the gun. I would hope in the next couple of weeks we're going to go live with steps, not just on what we should do going forward, but what we should have done. And I will wait until then to make any statements about what may or may not have been done that was either aggressive or not sufficiently in front of this. No state was prepared. No long-term care facility infrastructure as an industry matter was prepared. And as I said, the performance was incredibly uneven. But we're looking at it every which way.
Yeah, and certainly operators do deserve some of the blame for the way they've protected their residents. But you had a pretty explicit case of let's let some of these people back from the hospital into the homes based on a health commissioner's order, and then outbreaks in those homes. So as you look at it, as Governor Cuomo has finally said that that was a mistake, do you believe that that order was a mistake just based on the data and the evidence and what happened once some of those patients went back into the long-term facilities?
Yeah, I think, Willie, one of the points that needs to be made, even at every step of the way, there's been a strong directive toward cohorting patients. And that's been part of our mantra, our health commissioners' leadership from day one. But again, we've had an outside independent team looking at long-term care now going on a month. And they're going to hold up a mirror to what we've done and what we should do as an industry going forward. And I want to wait to see what they come back with.
And do you have just a gut feeling, I know you want to wait for that, but about whether or not it's a good idea to send patients who've had COVID, who've tested positive for COVID, and put them back into those group settings?
Well, I think if they're cohorted, Willie, that's a different reality than just throwing people into the mix. And cohorting was something that was part of our health commissioner's directives from day one. That seems to me, you've got another issue here, by the way, which we haven't talked about. You've got heroic staff going in and out every day. Early on, it's pretty clear that you had some asymptomatic carriers who did not realize it and unwittingly passed it on cross generations, which is another reality here that we've been dealing with and trying to make sure we've managed that through aggressive testing and cohorting of staff as well.
So, Governor, we've been talking about the here and now. Obviously, you're worried about Memorial Day weekend. You're worried about when you can get restaurants beyond just takeout and get some of those places opened up. But obviously, you and your staff are looking over the horizon as well towards schools come September. How are you looking at that right now? Because there are an awful lot of parents and students who are going to be kind of going through this summer wondering, when do we go back, or do we go back at all?
Yeah, I'd say the following. We've got a small, if not a large army looking at this right now. We're planning on going back. That's going to be our base case. But we've got to do it in a responsible way. We've got to do it, the basic social distancing realities, face coverings, but we've also got to do it with respect to teachers and administrators and this whole notion of cross-generational spread of the virus. I said yesterday that we're going to give guidance to parents and kids and educators and staff, I hope by early to mid-June. And there's a lot of uneasiness around this, understandably, right now. We want to make sure we get this right. And as we've said all along, indoor stuff is a lot harder than outdoors. So, you'll see outdoor dining, for instance, in New Jersey before you'll see it inside. And schools obviously have a big element of their reality, physical presence is inside, but we want to get it right, and we're preparing on the path that's what we will do. We're going to give guidance at some point over the next few weeks.
So, Governor, just a quick follow-up. Jessica over here, just a quick follow-up on Willie's questions. A couple clarifications here. First of all, you talk about cohorting when Willie asks whether it was proper for the state to order long-term care facilities to take seniors back in without COVID-19 screening. As it pertains to this issue, what do you mean by cohorting? Cohorting patients, and again, this is an industry with in New Jersey and in every American state with a huge number of operators. So this is not like hospitals where you've got a very finite number of, in our case, 71 systems. You've got hundreds and hundreds and hundreds of these operators. So you've got to look at the performance of each one of these operators. I mean cohorting based on symptoms and or actual positive tests, and that includes both for residents, but also, as I mentioned at the end of Willie's questions, it also includes for staff. We've lost far too many lives of folks who work in these facilities as well. And as I said at the beginning, you had unwitting carrying of the virus by asymptomatic staff members early on, and that was a challenge that I hope, God willing, have dealt with sufficiently. And one final question. I haven't heard the answer. I think you may have said you're going to wait for a study to come out. But let me just circle back and ask one more time, just clearly yes or no. Do you think the previous health care order was a mistake to send seniors back into these long-term facilities? Joe, I do want to, we're not bashful about getting nothing but the facts in terms of how this was handled. And as I say, we've hired a third party to come in, not just to help us figure out what's happened, but also help us plus up in the here and now. This is going to depend, so I'm going to put that aside for a second. If patients were properly cohorted, according to the directives from our health commissioner, and that was executed properly, the answer is, you'd have to say the answer is yes, that was okay. If they were not cohorted,
and/or it was not executed at the center level, at the long-term facility itself, then clearly that's a big problem. That's concerning.
Governor Phil Murphy, thank you very much for being on with us this morning. And coming up at 9 a.m., another governor, California's Gavin Newsom, will be Stephanie Ruhle's guest. And still ahead this hour on Morning Joe, we just reported the latest unemployment claims. Coming up, we'll talk to two senators about their plan to help small businesses keep their employees. Democrat Michael Bennet and Republican Todd Young. Next on Morning Joe.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.